5 treatments for fissure from least invasive to most invasive. I'm Dr. Karen Zagian. I'm a board certified colorectal surgeon. Let's talk about what a fissure is and how we treat it. So a fissure is a tear right down here, right in there at the bottom of your GI tract, right at the exit, caused by either a bout of constipation or diarrhea, most commonly. So least invasive way to treat a fissure, right at home, high fiber diet, drink plenty of water. You want to have nice, consistent, soft bowel movements. Number 2, soaking in a warm bath or doing a sitz bath helps relax the pelvic floor muscles and increase blood flow to the area so the wound can heal. If your symptoms of pain after bowel movements that feel like a sharp tearing, stabbing pain or rectal bleeding continue for, let's say, more than a month, you should really be seen by a colorectal surgeon. When fissures are diagnosed early in the process, they are much more likely to ultimately heal and avoid having to get to the most invasive treatment, which is surgery. When I see a patient in the office with symptoms that are suspicious for a fissure, I go ahead and do an external exam first, and for the most part, we can diagnose these by just spreading the butt cheeks and looking in the correct location. Most fissures will be right in the midline, most commonly in the backside toward your tailbone, and sometimes occasionally toward the front side. Once we diagnose a fissure, I may do a digital exam, mainly to make sure that your muscle is tight, which is the common situation with a fissure. Once we know that the muscle is tight and that's the contributing factor for a fissure, we go ahead and prescribe topical prescription ointment. This is different than over-the-counter hemorrhoid creams, and what this does is it actually helps relax the muscle in order to increase blood flow to the area. The physiology of a fissure and the reason for the non-healing and development of a chronic wound really has to do with the high tone that can occur in the muscles as a result of the tear that then prohibits blood flow to the area. So by treating the tight muscle, we can actually help these heal. In my experience, Botox works really well, and I inject a high dose, and I have a special technique that allows delivery to the right area in the right increments in order to allow healing. It's pretty uncommon to take somebody to surgery once they've had appropriate Botox treatment. Surgery is the last resort for fissure, and in surgery we generally are doing a sphincterotomy, which is cutting the muscle in order to relax it. The reason surgery is the last resort is because sometimes we can overshoot, cut too much muscle, and then cause an opposite problem where the fissure heals but patients do not have control over their bowel movements and can leak. And that is a much feared complication that really nobody wants to face. Let me know if you have any questions about treating these stubborn wounds.